This topic has some personal interest for me because I just spent the last year caretaking for two elderly parents. My dad, 92 with diabetes and all kinds of foot issues, neuropathy. And in reading your paper, wow. So this patchwork of coverage across the 50 states and DC is very complicated, which I had no idea. And on top of that, it looks like this is definitely a topic where we're brushing up the health inequities. The people with diabetes and CBD and these other sort of chronic diseases that are managed tend to be in, socioeconomic lower classes, larger proportions of communities of color. So explain to us, some key takeaways here on what you found.
Well, going back on what you said, I also cared for my mom when she went into a nursing home and got podiatry bills we had to pay. I will say Medicare, which obviously if you have a parent that's over 65, Medicare covers these services, blanket coverage. Again, for people that fall into those categories, diabetes, peripheral neuropathy being two of them. So again, that sort of sheds some light onto this inequity between Medicare and Medicaid. So I guess some takeaways from this. One is, as you mentioned, that I was struck with was just how disparate the sort of regulatory scheme was across different states. My background historically has been in criminal law. If you were interested in that, you went to the state code. It would be in a chapter there, and there would be some case law, but you knew where to find it. It really is just how kind of piecemeal these different programs are administered in terms of where you can find the regulatory documentation. You have one state that it was in a Medicaid provider manual, it said the word podiatry covered. There was a table related to copays, and then it just said covered. So there's one line in one table in one document that is the entire sort of regulatory scheme for podiatric coverage. And then you would have states that it's in 3 statutes and 2 different regulations, and it's all across the board. So that sort of struck me. The other thing that I wasn't prepared to find, or that was interesting, was how states deal with the concept of routine foot care, which would be something like clipping toenails or dealing with calluses and things of that nature. And our research team, when we did the 5-state memo, and then in sort of batches of 10, I had 2 researchers, each would do 5, and we would have weekly meetings. And it really became apparent how differently states handled this, not only from a coverage, not coverage standpoint, but just how they define it, how they define how people are eligible for the services. It really is all across the board. And there are situations, there are states where in one bullet point in a provider manual, it specifically says routine foot care is not covered. And in the very next bullet point, it will say routine foot care is covered if you have these conditions. And if you obviously people who deal with this for a living understand that, and there's the sort of prevailing professional and sort of regulatory information that gets passed out, and people that provide the care understand these contours. But if you are someone who's doing research on a particular topic, or if you're somebody that is looking at these documents for yourself to determine whether coverage exists, it's going to be very difficult for you to sort of pin down exactly what this means.